Hi everybody, this is Dr. Stu Weiss. I'm standing in front of this green screen today because we were doing some fun projects with green screen and chroma key. So this is what you see when people do like weather forecasts, and wherever there's green, it actually gets replaced with the map or whatever else is going on in the background. So that's why I'm standing in front of this today. I wanted to talk to you today about the expiring guidelines for social distancing. So you may have read that yesterday the guidelines from the White House, the 15 days to limit the spread of the virus, expired. And what that means is that there are no longer guidelines in place for the governors around the country to follow. The guidelines, although they were never really being enforced, they didn't have the power of law, they were federal guidelines. Now those have actually expired. So the problem is now the governors are left to balance the competing interests of the pressure to open up their states from an economic standpoint and the public health side of things and the lack of adequate testing capability. So now the governors are left to deal with that. So you will have some governors that are going to take the slow, cautious approach of reopening their state. They'll open slowly, they'll follow the numbers, and they'll keep their hand on the valve to close it quickly if the case numbers rise. Some other governors will be opening their states willy-nilly, which is very concerning, especially since the president 2 days ago said that he wanted to start traveling again and was looking to restart, quote, massive rallies. So there's a lot of political pressure, a lot of economic pressure for governors to reopen their states. But we still have lots of cases in the United States. Although the trend in the U.S. is going really in the right direction, from a high of about 33,000 new cases, we still now have 27,000 new cases every single day. And we also have hotspots in nursing homes and long-term care facilities, and we have other hotspots, as you read about and heard about in my newsletter, in meat packing plants and food processing operations. So we still have active virus circulating in our communities, and we have states that are opening up without adequate testing capabilities and without adequate testing capabilities and contact tracing. So we're more or less back to where we were when we started to shut down in the first place. So here's my advice to you. If you're in a state that's reopening, protect yourself for 2 to 3 weeks. For one incubation period of the virus, which is about 2 to 3 weeks. Continue wearing a mask, even though it may seem silly if nobody else is. And keep yourself away from large crowds of people where you can't maintain 6 feet of distance. Give it one incubation period, and let's see what happens. Hopefully, there won't be a big increase in case numbers, and we will just slide right in to reopening our society without a big step backwards. If, however, we do have a big increase in case numbers, at least you will be safe. Thanks for watching. If you have a question, please send it to us at drstu.org. Have a good day, and we'll see you tomorrow.